here we are again. Welcome, guys. Welcome to another episode of Feel the Pedal podcast. That one podcast where we talk and discuss the latest advances in sports nutrition for cycling with the usual host, Gabriel Martins. And we've reached another important milestone. It's episode 20 of this journey. And once again, thank you for being on that side as a faithful listener. On the previous episode, we had a great talk with Professor Graham Close where we discussed the latest strategies to consider when facing injuries in cycling, and one of the inevitable topics that came up was all the issue of connective tissue repair, the possible yet misunderstood role of collagen supplementation that I assume many of you are aware of. And one of the considerations was that there are still not many studies comparing collagen with whey protein or another protein-based formulation. And this is where some of the recent research from our guest today comes into play. Her name is Sara Oikawa, as you might have guessed by now. Sara earned a Bachelor of Science in Kinesiology, a Master's of Science in Kinesiology, and a PhD in Kinesiology specializing in skeletal muscle metabolism and nutrition from McMaster University in Hamilton, Canada, under the supervision of Dr. Stuart Phillips. Sara's research has spanned several populations: young and older adults, pregnancy, cardiac rehabilitation, elite athletes, though the focus of her PhD was to determine the role of protein quality in physical activity and inactivity in healthy older adults. Nevertheless, throughout this episode, we'll go through her research and other relevant works on this area and try to find the practical implications that this new data has for cyclists and endurance athletes, and ultimately verify if all the fuss around collagen supplementation for athletes is justified or not. So if you're as curious as I am, sit back, relax, and enjoy this great talk with Sara. I can tell you right away that Sara has the voice of an angel, which makes this a really easy listen. Let's dig right into this episode 20, new developments in collagen research, implications for endurance athletes, up next on Fuel the Pedal podcast. Hello, Sara. Welcome to Fuel the Pedal. It's an absolute pleasure to have you here with us. How are you doing today?
Great. Thank you for having me.
Thank you for being here. We need to increase our ratio of female to male guests on the podcast and let the world know that there are many incredible, talented women on the research world. So thank you for contributing to that.
No, I really appreciate you having me, and I agree that we should increase that ratio, and I'm happy to contribute and be a part of it.
Awesome. So listeners might have already guessed by the title of this episode that you're here to talk with us about your research with collagen supplementation with Professor Stuart Phillips' research group, who's been here on Fuel the Pedal before. But that's only part of your academic and research career, Sara. Could you please tell us a little bit about you, your academic and research career so far, and basically what you've been up to lately?
Yeah, so I've been fortunate enough to complete my master's and my PhD both at McMaster University under the supervision of Dr. Stuart Phillips, who you've had before on the show, and he was an excellent mentor and really helped to fuel, if you will, my research passions and things that I was interested in, which was mostly in looking at protein quality, which is kind of what led us to using collagen in a lot of our work. My research interest has spanned quite a few populations over the last, 6 to 8 years. And my PhD focus was mostly on in aging and in older adults, but I've done a lot of work in young adults as well as some clinical populations as well. But generally, the main kind of thesis or the main point that we like to use was looking at the effects of protein quality, generally high and low quality proteins, to compare the effects of on skeletal muscle protein synthesis as well as some other side markers. So largely protein synthesis related protein metabolism work, but that's kind of where my research has taken me so far.
Okay, great. So we could say that you couldn't have had a better mentor and that your research is quite remarkable. So for that, congratulations, Sara.
Oh, thank you. Yeah, no, I definitely could not have had a better mentor. That's for sure.
Okay, Perfect. I also agree. So about today's topic. So this is a topic that has been previously discussed here on Fuel the Pedal before, and the last time on previous episode with Dr. Graham Close, where we've briefly mentioned the possible role of collagen to support injury during immobilization. And firstly, on episode 8 with Sarah's mentor, Dr. Stuart Phillips, and also with Dr. Felipe Teixeira. And on both episodes, the guests made reference to an interesting fact that we still don't know if the same outcomes and elevated markers observed with collagen supplementation on muscle protein synthesis or collagen synthesis could be obtained with other protein supplements providing similar or superior amounts of amino acids or increased protein quality. So it turns out that some of that research is starting to emerge out of Professor Stuart Phillips' lab at the University of McMaster in Canada, out of the hands of our guest here today, Sara Oikawa. And I've been keeping an eye on Sarah's work for a while now, and she has been performing some really interesting research in the past years as part of her PhD research. So two of her latest publications as the main author really caught my eye since she compared whey protein with collagen supplementation in one of the studies with older women. And a last one published on Medicine and Science in Sport and Exercise, where she compared lactalbumin with collagen on endurance-trained individuals with some fairly interesting results, which might have direct implications in the context of our podcast with cyclists. So we'll be also touching on another research on collagen by Sarah's group back in 2018 with older individuals as well. So the objective here with this talk with Sarah is to have her not only present her research, but also to have her opinion on what the implications that this new data can have on whether the claims around collagen supplementation for the purpose of tissue repair, of muscle protein synthesis, or even joint support are justified. So, Sarah, for the listeners who just got here and missed the previous episodes where we've mentioned or where we provided some context on collagen research, could you please give us a general overview on the basics around collagen? For example, what exactly is a collagen? What is the quality score of it in its supplemental form? And what are the claims made? And why did your research group went on or felt the need to perform these studies?
Yeah, so collagen is an insoluble glycoprotein that's found in all animals and humans, and it's the most abundant protein in the body. So as you might guess, that it's critical for all the structural components and all connective tissue found within the body. So that includes bone, tendons, cartilage, ligaments, as well as skin. But it's an interesting molecule in that it's mostly made up of the amino acids glycine, proline, and lysine, as well as hydroxyproline and hydroxylysine. So it's about a third of the molecule is actually made up of glycine. So when we're talking about protein quality scores, if you're not familiar with what a protein quality score is it's essentially a way for the World Health Organization to delineate differences between types of protein supplements. And so as part of their way of categorizing proteins and providing them with a score is that they look to see the amount of essential amino acids in the protein source, and then they base the rating on the most limiting amount of an essential amino acid found in that source. And so in the case of collagen, it lacks tryptophan, which is one of our 9 essential amino acids, which means that it's rendered a protein score of 0. So regardless of the other amounts of amino acids that are contained within the supplement, because it lacks an essential, it's given a score of 0. And that's true for both the PDCAS score as well as the more updated DIAS score. In terms of why we chose to use collagen as a comparator, it's not that we were out to, look at the negatives of collagen. It's more when we're trying to compare protein quality. For example, in our studies, we generally used whey, which has been well well shown to be a high quality protein, and it's effective for increasing muscle protein anabolism, which is our main outcome measure. And when we're looking to compare it to an isonitrogenous protein source, something like collagen peptides are an excellent comparator because they have a protein score of 0, which means that we're providing our participants with the same total amount of protein in an absolute sense. However, the quality between the two is quite drastic. So it would allow us to really show that protein quality is important as a supplement choice.
Terrific way of starting this discussion, Sarah. And I remember Stuart briefly mentioning that there may be some limitations to the studies performed so far when evaluating the outcomes from collagen supplementation, and mainly on the markers used to quantify collagen synthesis on tendons. So, Sarah, what can you tell us about these possible limitations or gaps in the research available so far?
Yeah, and so I agree with Stu that there are a lot of gaps in the literature, mainly from the way that we measure collagen synthesis in specific tissues. So if you're using a stable isotope tracer, I think that's our gold standard for determining collagen synthesis. But the difficulty lies in when we're looking at some of the blood markers of collagen synthesis is we can't determine where those markers are coming from. As I mentioned, there are tons of sources of collagen within the body. And so when we look at blood markers in circulation, it's really difficult to know from which we see where this marker is coming from. Since bone is the largest source of collagen in the body, it's likely coming from bone, but it's difficult to say. And I think that some of the misconceptions that we have when we're looking at collagen research, like you mentioned, there's not a lot of research out there, and it's only really starting to emerge right now. And that's in comparison to other supplements like soy and whey that have really been extensively studied in the past. So there's less evidence for collagen for sure, just on a whole, but I think the difficulty is a lot of that evidence is conflicting, and a lot of the evidence, at least anecdotally from people that have spoken to me about it, is they group it all as being one thing. It's all for the body in one sense, whereas we're really looking at it from a muscle protein analysis perspective, not from a whole body perspective. So all of the implications for joint health and tendon and ligament repair, I mean, those might be totally valuable insights and valuable uses for collagen, but that's not what we've used it for.
I see, and we'll get plenty of opportunities to get more deeply into this topic, but first I'd like to have your opinion about another of the possible limitations in the research available so far, which is the fact that, as you said, collagen, although being fairly high in glycine and proline when compared to whey, for example, or another animal-derived protein source, is deficient in tryptophan and therefore has a quality score of 0. Should we consider this reduced protein quality and perhaps bioavailability to be another possible limitation with collagen research?
Yeah, I mean, I do, but I think it depends on the type of source of collagen. So when you use a collagen peptide, which is what we've used in our studies, it's already been exposed to an enzyme which helps to break down the collagen into its individual peptides, which increases its bioavailability, because without this process, what happens is the collagen will form a gel, which reduces its bioavailability or its ability to be broken down in the body, and then it's for its amino acids to be used. So I think it's definitely a consideration if you were looking to supplement with any type of collagen, just ensuring that your source of collagen is correct for what you need it for.
Got it, Sarah. So having these topics and limitations into consideration now, let's dive in straight into the study you've performed with endurance-trained individuals, comparing collagen with alpha-lactalbumin on muscle protein synthesis on aerobic performance. And before we get into it, Sarah, I need to ask you, why did you decide to compare it with alpha-lactalbumin?
Yeah, so alpha-lactalbumin is a fraction of whey protein that's been relatively understudied. It has a very similar amino acid profile to whey, including very high levels of leucine, which if you were able to listen to the podcast done previously with you and Stu, he really mentioned that of the branched chain amino acids, it's leucine that we believe is driving this anabolic response. But importantly, alpha-lactalbumin is the highest dietary source of tryptophan. And so why we decided to use alpha-lactalbumin was because we were looking to see whether tryptophan may aid in recovery during high-intensity exercise that's simulating kind of not an overtraining, but an overreaching type of protocol, which is what we were looking to simulate in the study. And now why we used this type of protein was obviously for its recovery benefits, because we wanted to see whether elevated tryptophan would contribute to recovery. And then kind of coincidentally, an excellent comparator protein became collagen because it's devoid of tryptophan. So it would really help us to tease out the differences as to whether tryptophan had an effect on changes in recovery, specifically looking at looking at microfibrillar and then sarcoplasmic protein synthesis, and whether there was an effect of tryptophan on those measures. So again, the benefits of collagen being that we can provide the same absolute dose of protein, both from collagen and from alpha-lactalbumin. However, they have very distinct, different amino acid profiles that may change their response to overtraining.
Terrific, Sarah. So now that we got that clear, could you please summarize this research for us and what the main findings were?
Yep. So we had endurance-trained young men and women participate in a 2-week crossover study. And so we fully controlled their diets throughout the 13-day study. And so we provided all of their food to them, which included a protein supplement on training days twice a day. And so they came in for their training on Tuesday, Wednesday, and Thursday of each week. And following training, they were provided with 20 grams of their allocated supplement. And then 2 hours prior to bed, they consumed 40 grams of the same supplement. And so in week 1, so Tuesday, Wednesday, Thursday, they were provided with either alpha-lactalbumin or collagen. And then the opposite week, Tuesday, Wednesday, Thursday, they were provided with the opposite source of protein. And so we had a control period over the weekend as well. So between the Friday and the Monday of the following week, we were able to measure rested rates of protein synthesis where our participants weren't active, but also able to measure the integrated rates from their training and allocated supplement from week 1 and then week 2, which provided us with a really nice model to compare the changes in protein synthesis, again, both myofibrillar and sarcoplasmic. So our findings were essentially that for both myofibrillar and sarcoplasmic protein synthesis, that both rates were higher when consuming a high-quality protein of alpha-lactalbumin in comparison to consuming the collagen peptide supplement. And these are both elevated above rest, the control period that took place over the weekend, but they were improved when consuming a high-quality protein. And so you mentioned bioavailability, but what I really think it boils down to is the higher leucine content of alpha-lactalbumin. So alpha-lactalbumin, as I mentioned, has this very similar leucine content to whey, meaning it's quite high and is likely driving this increased protein synthetic response in comparison to collagen, which we know has a very low leucine content. So I think really what it boils down to is consuming a complete protein in alpha-lactalbumin that is higher in leucine.
Yes, and that would be one of the points that I would really try to obtain from you, and that really caught my attention when reading this work, which is, although you've provided an isonitrogenous amount of collagen and alpha-lactalbumin, the responses were quite different, which highlights what you were referring to, the importance of protein quality, in this case leucine, at least for muscle protein synthesis. And as I understand, this was not the first research you've performed on this topic. There is previous research by your research group at McMaster's from 2018 on the American Journal of Clinical Nutrition, and a much recent one also on the American Journal of Clinical Nutrition in this present year, 2020, both with older participants. So Sarah, could you please talk us through your 2018 research and tell us what exactly have you compared and what the findings were?
Yeah, and so I apologize to your listeners who are hoping to listen to maybe studies more about cycling or endurance exercise. But again, my my main focus and my main research passion is sarcopenia and aging. And so one of the things that we looked to determine was whether we could attenuate the loss in skeletal muscle mass, as well as the loss that we typically see in muscle protein synthesis that occurs with a period of disuse. And a model that we use frequently in our lab is called a step reduction model. And so what we do is we ask our participants who wear a pedometer to reduce their daily step count from, they're taking anywhere between 3,500 and, 15,000 steps per day, depending on their activity level. And we ask them to reduce their step count down to 750 steps per day, which is on the higher end, actually, if you can believe it or not, of the steps that are taken during hospitalization. So if you look at the spectrum of if you're in hospital for one day versus a week, the highest number of steps we typically see that patients take in a day is around 750, which is quite alarming. It's less than a kilometer walk. And so what we were trying to do was to see whether if we provide participants with a high protein diet that is supplemented with a high versus a low quality protein, in this case we used whey and collagen peptides, whether we could attenuate some of these declines that we see. One of the other things that we did as an intervention through this study was we reduced their caloric intake. So we maintained their protein intake at 1.6 grams per kilogram per day, which is twice the recommended daily allowance in an effort to attenuate this loss. But we also put them in a state of a negative caloric balance in order to simulate what might happen if you were ill, because you generally don't eat as many calories when you're ill as you do when you're not. And so the interesting things we found was that there weren't differences between our whey protein supplemented group and our collagen peptide supplemented group in their loss of rates of protein synthesis in our first little window there, which was just energy restriction. So before they even reduced their daily activity. And again, when we reduced their daily activity, there actually wasn't a change between in losses of rates of protein synthesis between the energy restricted only phase and the energy restricted plus step reduction phase. And so that really speaks heavily to the effects of energy restriction on rates of protein synthesis. But where we saw the difference in our supplemented groups, and they were provided with a twice daily serving of 30 grams of either supplement a day, was that in their 1 week recovery phase, so we allowed our participants to return just to their normal levels of physical activity. So we didn't provide them with any kind of structured exercise program. And what we saw was that the whey protein group showed an increase in their rates of protein synthesis. So we only studied them for a week, so they didn't quite return back to levels that we saw in baseline, but they were trending to return back to their previous rates of protein synthesis prior to energy restriction. Whereas when we look at our collagen peptide supplemented group, we saw no change in these rates. And so they remained attenuated, which is quite scary if we think that these individuals were still consuming twice the recommended daily allowance for protein, that really consuming a low-quality protein as part of their diet was extremely detrimental to their recovery. And if we extrapolate this out over the long term, what kind of implications will this have on their ability to return to their previous levels of health?
Sara, I'm sure the listeners will understand and forgive you for not doing this research on an athletic population. So don't worry, Sara. No, I think we must understand that not always we can perform studies with athletes, especially the truly elite breed, which is a common limitation we have across all fields of research, I think. And in this particular context, yes, Sara's research focus was on clinical populations, but we'll try our best here to see if there are implications for athletes that we can take out from Sara's work, and that's why we're having her here to have her opinion on the implications this might have and to inspire, of course, future research to be performed. And before getting into those possible implications, Sara, you then went on to perform another study comparing whey protein with collagen on markers of muscle protein synthesis, published this present year, 2020. So before we get on those possible implications of both studies, could you please get into more details on this last study and what the main findings were?
Yeah, so our most recent study was looking, it was a bit of a follow-up from our 2018 AJCN paper, where we did see that recovery that in muscle protein synthesis that occurred with whey protein supplementation in comparison to collagen peptides, where we didn't see any recovery of those rates. And so it was a bit of a follow-up in that we were trying to determine, both acutely and using both acute measures of protein synthesis and integrated rates, whether kind of where this difference stemmed from. And so allowing our participants to be active, we used a unilateral model. Again, that's pretty common within our research group, where we have one leg that resistance trains and one leg that doesn't. And what that allows us to do is, when you consume a protein supplement, which will go to your whole body, we are able to capture the effects of resistance training and protein supplementation in one limb, and the other limb is just the effects of feeding. And so we had healthy older women come in for about a 9-day period. On one day, they participated in an intravenous stable isotope infusion day, which, if you've ever participated in one of those studies before, you know can be quite a burden for the participants. So, of course, we appreciate their time. Our older women were fantastic. And so they came in for their acute infusion day, where they performed their bout of resistance exercise and were provided with their allocated supplement, again, either 30 grams of whey protein or 30 grams of collagen peptides, and we measured that acute response. And within that period of time, over 6 days, we also measured the integrated response to the effects of resistance exercise and feeding during a 6-day period. So our participants came in, again, throughout the week to do their resistance exercise on their one limb. And the interesting finding here, and something that really, really struck me, was that, as you would expect, with resistance exercise, there, at least acutely, there was an increase in rates of protein synthesis. And when we provide whey protein, which is, of course, a high-quality protein, we see that this rate is elevated even further. With collagen peptides, which you know are a very low-quality protein with very little leucine, acutely, we saw an increase in the rate of protein synthesis with exercise, but the effects of feeding alone did not increase rates of protein synthesis. So on over a 4-hour period, we see this increase with exercise alone with a low-quality protein, but we don't see it with just feeding. Then when we look over a 6-day period, and where I found this evidence to be the most alarming, was that with whey protein, it is as you would expect. So feeding alone with whey protein increases rates of protein synthesis, which is not surprising. And then when we add resistance exercise, we see that this rate is higher than feeding alone. Again, unexpected. So whey protein, great. It goes in kind of a stepwise manner. So feeding is better than not feeding, and then resistance exercise and feeding is greater than feeding alone. When we looked at collagen peptides over a 6-day period, we saw no increase in the rate of protein synthesis in older women. So when provided with a twice daily supplement, so 60 grams on top of what they were already consuming, and I didn't mention this before, but it was a fully controlled diet for these participants. So their protein was pinned at around 1.8 grams per kilogram, but we saw no increase with feeding alone of collagen peptides, and no increase when collagen peptides are consumed along with the resistance exercise. So when older women are consuming over twice the recommended daily allowance for protein, if it's a low quality protein, we're seeing no beneficial effects, at least in terms of muscle anabolism.
Perfect, Sarah. So let's try to summarize this for the listeners. So with exercise, as expected, rates of muscle protein synthesis were elevated, and with whey supplementation, these rates were further enhanced, but not with collagen plus exercise. Then, after 6 days with controlled diet and protein intake, I believe you mentioned 1.8 grams per kilo, whey was able to elevate muscle protein synthesis, but not with collagen, at least considering older women and markers of muscle anabolism, as you referred. Is this accurate?
Yes, yeah.
Terrific, Sarah. And I also wanted to touch on the markers of connective tissue that you've also measured. But before that, Sarah, now taking into consideration both research papers that you've performed with older adults, in your opinion, based on this data, is collagen supplementation recommendable for this population, whether it is for muscle mass preservation or for tendon repair, immobilization support, and eventually on athletes who seek collagen supplementation as a possible way of increasing their endogenous collagen synthesis?
I think in terms of muscle protein anabolism, I wouldn't recommend consuming collagen peptides for that purpose. I mean, as, again, the research is limited, so there are probably more papers to come out that may say the opposite, but based on what we've done in our lab, with gold standard measures of to measure muscle protein synthesis, I would say that consuming collagen peptides for that purpose would not be effective or would be limited in its efficacy. So I would definitely recommend consuming a higher quality protein in order to stimulate that response. In terms of connective tissue and joint health, there was a recent meta-analysis that showed that in patients with osteoarthritis, that consuming collagen peptides improved their indices of joint pain. And so there may be some effect of collagen supplementation to improve joint pain in patients that are experiencing this type of discomfort. But I think in a healthy adult population, we wouldn't see that effect because our participants were free of any chronic conditions. So they weren't able to, they couldn't participate if they had. I think as well, it's again difficult to say because when we look at our markers of, in our last study, we looked at muscle specific collagen protein synthesis and we didn't see any effective feeding. And that might be where you do expect to see an effective feeding is on the collagen synthesis itself. But I think what's important and what Stu alluded to in your previous podcast is that the amino acids found in collagen that aren't found in whey, such as hydroxyproline and hydroxylysine, they aren't able to be post-translationally modified. So they can't be used when they're consumed. So it doesn't really make sense to use collagen peptides as a way to increase collagen synthesis when you could use a high-quality protein, which may provide benefits to both muscle protein synthesis and collagen synthesis.
Yes, and that would be one of my following points that I wanted to confirm with you. We know that perhaps we shouldn't expect collagen to increase muscle protein synthesis due to its low leucine content, as you've mentioned, but even when only considering connective tissue repair or connective tissue synthesis, is it any good to have this increased supply of glycine and proline, or is there any role of leucine on tissue repair as well?
Yeah, I think tissue repair is a difficult question because what tissue are we referring to? And each tissue will require, a different, maybe stimulating amino acid in order to improve tissue repair. So I think, again, from the perspective of skeletal muscle, leucine is so key. And consuming a protein that's lower or extremely low in leucine, as is the case of collagen, it's just not helpful for skeletal muscle anabolism. In regards to collagen, where again, you mentioned that it's high in glycine and high in proline, you would think that consuming a supplement that's higher in those two amino acids may improve synthesis. However, both glycine and proline are non-essential amino acids, meaning that our body is able to produce glycine and proline typically in sufficient quantities in order to support their need. And so I don't really see the need to consume a protein source high in non-essential amino acids when you could make the choice to consume a protein source that's high in the essential amino acids.
Sarah, and would you say that if we consider an injured cyclist, for example, just aiming to consume a high-protein diet supplemented with whey protein would be the best possible strategy to support recovery, including connective tissue support?
Absolutely. I think that consuming whey protein or any high quality protein in athletes is going to have a greater advantage. And again, if the theory proves true, and again, it's just a theory, it's nothing that we have tested, but that if you're to consume a high quality protein over a low quality protein, because the high quality protein would ostensibly support tissue synthesis in other tissues that aren't muscle. So if that is the case, I do believe that whey protein would be a benefit to cyclists. And from our study in MSSC that showed that alpha-lactalbumin had greater rates of synthesis of both the myofibrillar as well as the sarcoplasmic protein, which contains the mitochondrial proteins, since those had greater elevation when consuming a high-quality protein following cycling exercise. I really do believe that if we are trying to improve muscle quality, quote-unquote, consuming a high-quality protein does appear to induce those types of benefits.
Terrific, Sarah. And this leads us to the next question I had for you regarding a summary of the importance of protein quality, which is what we've been discussing here so far. And based on all the papers we've been discussing here and all other research you've been doing with Professor Stuart Phillips in the past few years, how important do you believe protein quality really is, not only for injury support, muscle protein synthesis, but also when considering training adaptations in cyclists, for example?
Yeah, I mean, it's difficult to say. I know that there is some literature out there that suggests that consuming a protein supplement over a prolonged endurance training adaptation may not induce significant benefits in comparison to not consuming a protein supplement. And I think what's important to consider is that it depends on your level of training and your fuel usage. And so if you're simply trying to improve your endurance adaptations as an untrained person, you might be getting sufficient protein from your diet, especially if you're a younger person for whom we know that they're more efficient at using protein than older adults who require a greater protein dose to exhibit the same response. And so at the elite level, I think that any advantage that you could gain by consuming a high quality protein and being able to remodel your skeletal muscle that much better, even if it's just a marginal amount, may induce some sort of benefit. But again, I think it really depends on the individual and their training level and experience.
Sara, and moving our attention now more closer into the whey protein effects on athletic performance, would you say that athletes and cyclists in this particular case who already reach 2 grams per kilo of protein intake per day would also benefit from whey protein supplementation for the reasons we've been here discussing, or these benefits would be diluted once you reach this 2 grams per kilo?
Yeah, that's a great question. I mean, I think it depends on whether we're consuming the supplement above the 2 grams per kilogram we're already consuming, or whether we build it into the 2 grams. So some older work from Louise Burke has shown that where she categorized the food sources of strength-based athletes versus endurance-based athletes. What was kind of something you can tease out from that work is that endurance-based athletes consume a greater proportion of their total protein that comes from grain products versus strength-based athletes, which it came from meat and dairy. And so despite consuming a very similar level of protein in grams per kilo, we see that the food sources that they choose to get their protein from is quite different. And so I do believe that if you were to increase the quality of protein within your 2 grams per kilogram per day, that might provide some benefit for tissue repair, absolutely. But again, we're limited on our knowledge of what types, especially in the collagen research for tendons and ligaments and bones, how is consuming collagen or how is consuming whey really impacting this type of repair? It's tough to say.
Sara, I wasn't planning on asking you this, but it just came to me spontaneously since this is right now another hot topic at the moment, thanks to a particular Netflix documentary that everyone knows regarding vegan and vegetarian athletes. I won't make any personal comments to it. I've had my share of public talks and classes to some of my students here in Spain, but I would really like to have your opinion on this one. Would you say that vegan athletes need to have some special concerns about protein quality, especially some amino acids supply in their diet, even reaching close to 2 grams per kilo?
It's a difficult question to answer, and because vegan athletes, it's definitely possible to be an elite level vegan or a vegetarian athlete that's not, really up for debate. I think the importance really comes from how you consume your protein, whether you're a vegan or a vegetarian. So there are tons of excellent vegetable sources of protein. Specifically, soy protein is an excellent source of protein. It's a complete protein and contains a significant amount of leucine. And so what I think we really need to get around, and one of the greatest misconceptions in protein supplementation, is looking at our protein on an absolute gram per gram basis. Because if we look at, a gram of whey versus a gram of soy, there are significantly different levels of leucine or different levels of other essential amino acids that we can't just take every protein as 1 gram of whey is equal to 1 gram of soy equals 1 gram of collagen. They're all different. And so, yes, it is possible to be an elite level vegetarian or a vegan athlete, and they're obviously doing it very well if they're at that level now, but they likely have a really good idea of what they're putting into their bodies and how much. So they're making sure that they're getting all of the essential amino acids that they need in order to stay at that level. And that might, end up looking like they're actually consuming on a gram per gram basis more protein than someone who's a non-vegetarian or a vegan athlete.
Before starting to wrap up here, Sara, and coming back now to collagen again, we often see people using gelatin as a source of collagen and starting to use it right after an injury. So my issue here would be the following, and I have a good colleague and friend from Portugal who's one of the nutritionists of FC Porto, Antonio Pedro Mendes, and he was the one who brought this to my attention. Each dose of gelatin, let's assume a sachet or a small dose containing 17 grams of gelatin, might just provide under 2 grams of collagen, which is fairly inferior to the amounts used in research, yours included. So I'm guessing what your answer is going to be, but would you say that gelatin consumption even worth considering or even worth the trouble for athletes who just got injury to support recovery?
Yeah, I think that, I'm not an expert in gelatin by any means, but I think that the difficulty that comes with consuming gelatin and its bioavailability is that it has formed this gel already. And so what becomes difficult is for us to break down gelatin into its individual peptides so that they can be used for tissue synthesis. And so I'm not as familiar with the gelatin literature specifically in endurance exercise, but I would imagine if you did feel the need to increase your collagen intake, that consuming collagen peptides as your form of collagen would be a better bet.
Perfect, Sara. So now that we got that clear for some of the listeners who just might be engaging into that practice, let's go to the $1 million question, which would be, do you believe that there is any advantage in taking collagen for all the outcomes that we've been discussing here so far and the popular claims around collagen supplementation that couldn't be obtained by taking the same amount of whey protein, for example? And the reason I'm doing this question and the reason that I believe it's of particular relevance is that since collagen is much more expensive than whey protein, the cost benefit needs to be taken into consideration with every supplement that we choose to include in our diet, particularly since you could obtain more interesting amino acids with much less money. What is your take on this, Sara?
Yeah, I think from a muscle protein anabolism perspective, absolutely that, I don't think that collagen will be effective in supporting protein anabolism. And there is some research that will be coming out of a collaboration between Stu and Dr. Johnny Parisi at McMaster, which has compared the use of supplementation in some training protocols, which I won't get into. So we may be able to see those differences upcoming in terms of protein anabolism, but I really don't think that if we're looking strictly at skeletal muscle, that there is an advantage for consuming collagen over whey. But again, when we look at other tissues and going back to that meta-analysis that showed improved responses when consuming collagen peptides with knee osteoarthritis, I think that there are some proposed benefits for its use, particularly in the clinical population. But, I think that if we look long-term, kind of moving back into my first love, which is aging, if you're going to consume a protein supplement, it needs to be high quality. We really, even if we're looking at the benefits of tendons, muscles, or tendons, bones, and ligaments, mobility is such an important factor with aging that maintaining adequate skeletal muscle is so imperative for healthy aging that I can't imagine that we will suggest for older people to consume collagen over a high quality whey protein, despite some of the limited evidence that's out there. And that's not to say that whey is the only way to get that done. But I think being informed of the supplement that you're taking and what it's made up of, and again, not looking at protein on a gram per gram basis, making sure that you're well educated in what you're putting into your body can really make all that difference.
Yes, and I also believe that we should consider all options, and this is not just a matter of one food versus another, but we should be aware and informed about the amino acid content and protein quality of each source, never forgetting that we don't eat only isolated foods, of course, but a mix of foods and a mix of different protein sources, plant-based and animal-based alike, which is often where we fail to give a balanced overview of things in this current environment of diet wars and food tribalism. Would you agree, Sarah?
Yes, absolutely.
Great, Sarah. So what research developments would you like to see in the next 10 years on this particular topic of collagen research?
Yeah, I think if we're talking about collagen specifically, I think that there needs to be some more evidence to support the molecular underpinnings and support some of the proposed effects that have been shown with collagen peptide supplementation in the past that's been published in the last decade. I think moving forward, we just need to better understand those mechanisms because, our take on things is one-sided. We look at protein synthesis and we're not showing an effect, and that is true, but there may be other mechanisms that are taking place behind the scenes that we're not seeing that could be beneficial for consuming collagen supplements. And so I think what I'd really like to see moving forward is just more support for these proposed effects, or if not, the opposite. And it would just, I think at the end of the day, it's all beneficial for the end user, for the people that are taking these supplements.
Fantastic. So if people want to get in touch with you or follow your research or your social media interactions, where should listeners go to?
So my Twitter is just my name, Sara Oikawa. So it's at Sara Oikawa is my Twitter handle, which is my social media. But I will forewarn you that I don't use it strictly for academics. So I follow a lot of sports. So you'll see probably a lot of that if you do follow my Twitter.
Okay, let's bear that in mind, but nevertheless, I will include your Twitter handle on the show notes for this episode 20 on fieldthepedal.com, and I think we are done, Sarah. I think this really was a tremendous experience for me in a somewhat controversial topic, and we needed really someone like you who'd been in direct contact with this research to provide us with such a good feedback and insights. And for that, Sarah, for your research, for your presence here on Field the Pedal, you have my sincere gratitude, and it was a joy to have you here with us.
Thank you so much for having me. That was really fun, and I hope that it works out well and we don't get too much flack.
We surely won't. Don't you worry, Sarah. Once again, thank you for your time and best of luck for your future endeavors.
Thank you so much for having me, Gabriel.
And there you go, guys. Episode 20 with Sara Oikawa from McMaster University on the latest advances on collagen research. I had a fantastic time talking with Sara, who not only has the sweetest voice, but was also quite clear on her speech and insights. And I believe we all have now a much better understanding on the practical applications of collagen, and particularly the limitations inherent to this supplement, which I believe still has a lot of fuss around it. Once again, thank you so much for being on that side, and I'll see you soon on the next episode of Fuel the Pedal podcast. Take care, everyone.
Thank you so much for having me, Gabriel.